Philip Breitenbucher presents.
Good morning and good afternoon, and we appreciate you joining us for today's webinar. We see that there are many of you just now being able to log in, so we're going to give our attendees just about another minute or two to get logged in, and then we'll get started with today's presentation. Thank you again for joining us. Okay, thank you for joining our webinar today, and we welcome you to the Child Welfare Information Technology Systems Manager and Staff Webinar Series, brought to you on behalf of the Health and Human Services Administration for Children and Families, Children's Bureau. Today's webinar will discuss how states are using remote and/or distance training and learning for CCWIS rollout and effective implementation. This webinar session will provide an overview of key strategies for effectively engaging in distance learning and for training and user support. Our state panelists will share their best practices experiences for the recent rollouts, and webinar participants are encouraged. So we encourage you to ask questions and share your own experiences about how your state has embraced distance or learning or remote learning. Our webinar presenters today are Nicole Harder-Schaefer, who's a federal analyst at the Administration for Children and Families. You'll also hear from Kevin Jones, who's the Chief Information Officer for the state of Indiana. You'll hear from David Iyer, Deputy Executive Director of Operations in Maryland. He will be joined with his colleagues from Maryland with Rob Starkey, Director of in Strategy and Operations, and Jeffrey Lynn, who's the CJAMS Program Manager. And I am your webinar facilitator, Phil Breitenbucher. Again, today we'd like you to participate in this webinar, in this discussion. So we will pause for periodic question and answer sessions, and you may submit those questions in a couple formats. Throughout the presentation, you can utilize the Q&A button, which you may find at the top of your screen or on the ribbon. You can also use the chat function and submit questions to us that way. We can respond directly to you, or you can also use the raise hand function so that we can unmute your line so that you can ask the question directly to the panelist. These questions that you ask may be addressed to an individual speaker or to the panelist for just general discussion. After the webinar, you may email questions to your federal analyst or to cwis.questions@acf.hhs.gov. Okay. As I said, today we're going to hear probably a pretty relevant topic. We're going to hear just a quick overview of remote and distance learning strategies. We're going to touch on how we can ensure connection and engagement and assessment of that process. And you'll hear from states share about their CCWIS implementation and rollout, the partnerships and infrastructure they developed, and some key lessons learned. Then we'll go ahead and wrap up with some final thoughts and close this out. With that, it's my pleasure to introduce to you Nicole Harder-Schaefer.
Title slide, traditional versus remote training.
Good afternoon, everybody. While the topic of training is familiar, it's likely changed in the environment. Historically, training has been delivered in person, either regionally or locally in classrooms with hands-on activities, with access as well to the facilitators and super users. For many different reasons, states have begun to engage in remote and distance learning. So we'll be looking at how the users are accessing the training, how the training is being assessed, how it's being tailored, and the content, as well as the connection to the end users. Next slide, please. We'll be looking at key strategies when it comes to remote and distance learning. We're going to be looking at accessibility, engagement, connection, clarity of the material, flexibility, and the assessment and evaluation. Next slide. There will be time for question and answer after each speaker. So now I would like to introduce and hand off to our first state panelist, Kevin Jones from Indiana.
Thank you very much. I appreciate the opportunity to share with you guys and looking forward to just giving you a little bit of a view of how the state of Indiana is helping with implementation and training and making sure our people are prepared to utilize our systems and execute the continuity of business. The Indiana Department of Child Services overall is an agency, one of the second largest agency in the state of Indiana. And we were originally a part of our Family Social Services, the Medicaids, the FNS and TANF world. And our agency split off and we were split to own the current business models of child welfare and child support. So I am responsible for the scope of IT for all of our child welfare systems, Title IV, Title IV-E, and making sure that we're implementing the child welfare system and child support system. Our total head count is approximately about 4,900 employees. The large majority of those are around 3,700 case managers that focus on child welfare. We also own another process in Healthy Families, which is another 1,000 case managers that are outside of our scope. And in our child support system, we are a state-centered owned process, but we have a cooperative agreement with all of our county prosecutors, our county clerks, and the judges, and they execute the enforcement. We manage the administrative part on the state side. So that group is also another 1,500 users, not owned by the state or employees with the state, but in a cooperative agreement with the state. Our caseload and scope, so our total caseload for child welfare generally, we execute about 250,000 investigations a year. And from those investigations, we generally substantiate about 10 to 11% of those as hearing findings, and we have currently around 24 to 22,000 children in our care. And on the child support side, we process approximately $620 to $650 million a year in child support payments for the state of Indiana, both Title IV cases and non-Title IV cases, 4D, non-4D. So we do try to execute at a large scope and expand outside of what is required from the Title IV realm when it comes to child support. We are currently in the process of implementing a new replacement system for both systems. And one of the things that we focused on is really how do we bring those systems together? How do we move to a more current, more modern platform, taking what we're responsible for and being good stewards of what we're responsible for, and primarily transitioning and not owning the overall aging, the overall depreciation of the systems. And we wanted to make sure we were implementing a system that's in continuous improvement. It's not 20-year-old code. It's not 5 to 10 years worth of deliverables that it makes it another 5 or 10 years old. We focused on a platform leveraging Salesforce and Cardinality and MuleSoft to be able to implement a solution that will continuously improve as our business changes. So the day we turn it on, the system is new, and the day, and 5 to 10 years later, it's still as new as the day we turn it on, and even as new as the day we gather our requirements. And the current status for both, we're in the middle of DDI for our child support system. We're started DDI in June, and we're already at a point where we're looking at implementing our first deliverable, which is taking our own mainframe system data structure from 92 different counties, normalizing it and creating a business intelligence platform so that we can see our data and our performance so that we're executing and performing at our best to improve for the federal standards and federal participation. And with the child support welfare system, we just started DDI. We completed an org design where we actually started looking at our processes first, and then we moved to the development of the system, and then we look at implementation. Next slide, please.
Title slide reads, VR platform will provide user experiences that build self-awareness as well as BI to make sound evidence-based decisions.
One of the things that we really started to focus on in our training and looking at how we can be more productive, how we can improve and take our training to the next level is really starting to focus on evidence-based decisions. And one of the things we started with was our new platform, Salesforce. We were able to really start to take a look at what are we doing and what are we not doing well. And one of the things we really needed to take a look at is how are we performing? Why are our people leaving? I think all of us in the child welfare side have a PIP requirement to actually understand our staff turnover. And one of the things that we saw early when we started this project, we saw that staff turnover was about 50 to 55% in our FCM roles, which is massive. That's 3,800 individuals turning over. We're replacing anywhere between 1,000 and 1,500 people per year. And that cost for us was close to $70 million. One of the things we really wanted to understand is why. And when we did the survey, we built surveys, we built an ability to collect situational awareness and truly understand why are people leaving. And ironically enough, we saw that 53% of the people were leaving because before they took the job, their expectations were different than after they got the job. So one of the things I'm used to using as a classical systems engineer, I'm used to using simulations and virtual reality, augmented reality to get an understanding, to provide an experience, and to develop the constant and consistent performance that we would expect from our employees as well as candidates. So we decided to use virtual reality as a form to actually identify individuals and understand which candidates are our best candidates, give those individuals the opportunity to say, no, this is not for me, as well as us to really give them an evaluation prior to going through and being hired to understand, would this person be a good fit, not just from their approach to executing child welfare, but also with their personality and their methods and how we train, as well as how we engage with our teams. So what we did was we used VR, and we began to put all of the potential candidates from our potential hirings to say prior to making them an offer, and they've gotten that far to where we would have made them an offer traditionally, we would run them through two scenarios. The first scenario was we would put them through going in, doing an assessment in a home where mom and boyfriend are maybe intoxicated or impaired by some reason. The daughter actually has a bruise on her arm. Bio dad actually made a call saying that he suspects child abuse. And you go into a home with real live actors, real scenarios, and you go through the process of going through and assessing, asking questions, interviewing all three parties, and then making a determination at the end of that assessment, should you remove that child. What we were able to discover was that we put all the candidates that came through, approximately last quarter, we ran up close to 120 candidates. What we discovered was when we first ran those candidates through the scenario, we realized that only about 55% of those candidates were true candidates that we would hire. Historically, we would have offered all 119 individuals that opportunity. But what we did was anywhere between 55 and 60 of those people, we offered them a position, and then they in turn, only 45 to 50% of them even accepted the job. And those individuals got an opportunity to say, you know what, this is not for me. Out of that 119 people, we actually had 30 become employees. And I'm happy to say that after a year later, only 4 have left. And that represents a huge drop in our overturn for staff. We went from originally 50%, and we had an 18% reduction. But as we rolled this particular process out and use it in those particular regions, we went down and we're running at 19% staff turnover. And the results have been amazing. And we're looking at how we can continue to influx this type of evidence-based decision and make sure that we're providing an employee engagement that is satisfying to our employees and allow them to continue to stay. Next slide.
Slide title reads, COVID-19 challenged our sense of what ordinary is, and it has required extraordinary responses and solutions.
One of the things we like to focus on particularly was an issue that came up with COVID-19. All of us are dealing with COVID-19 issues, and all of us still have to focus on serving the most vulnerable population in our society. So our focus is making sure, and my focus as a CIO is making sure that my frontline staff have everything they need, all of the situational awareness they need, everything they need to support them. And when they need something or change, or we need a change, or we need additional support, we're providing that so that they can in turn provide the most vulnerable population the positive outcomes and results that they need. One of the things we really focused on was when we all were forced to go at home and work from home, and then we were required to go back to work. The one thing in my mind I wanted to ensure is that my FCMs were not going back to the office afraid that their coworker next to them may be bringing them something that could infect them, and then in turn go home and infect their family, and overall potentially impact how they take care of their family. So one of the things we wanted to make sure we did was focus on the three things from IT that we think are pillars: respond, collaborate, and communicate. We built what we call our office tracker that allows us to be able to look at all 92 counties, and within CDC guidelines, each one of those 92 county offices has a limitation on how many people can be in that building. We rolled this product out and we collaborated with the business, and we were able to design a future state system and potential in 8 hours. We spent 8 days working directly with the business on all sides, everyone who's going to be using this. And then after 8 days, we had a system ready to go to production. And from that system of record going into production, we were able to build training and train our immediate field staff and what we call our enterprise group, which is focused on change, and we call them our user experience committee, which is approximately 275 individuals out in the field, and they serve as what we would call our trainers or super users. And those individuals were trained in one day, and then the second day we trained all 4,000 users, and on that Wednesday, it was rolled out to the field. Individuals went back to the office, and the first graphic you see is a picture where we can actually see all 92 counties. Are you above capacity or within capacity limits? How many people are actually in the office? This is showing 223 at the time. And in those other graphics, you see future times. So who was in the office yesterday and 2 weeks ago, as well as who is going to be in the office in the future. The value to that is it allows us to be able to do actual contact tracing. So when an individual schedules to come in, we know exactly what their activities are. We can look at their cases, who's assigned. We can look at the activity. Then they can go out into a home. And if they come back and either a parent and or the FCM reports that I have COVID-19, we know who we need to contact that was in the office with them. We know the cases they were on and any in-home visits, and we know the scope and the magnitude without panic to be able within 30 seconds to know everyone who we need to potentially contact, and then monitor that group so as in other individuals within our office may be infected, we contact their families. So we're able to do contact tracing, and the sense of security that provided to our FCMs has been amazing. I've received emails on top of emails talking about how much safe they feel, how easy it was to learn, how the training was implemented, and how we were able to roll it out using our collaboration tools, such as Teams. You know, our organization completely rolled onto Teams within a week because we were forced to. And there was resistance in all aspects of our groups and our teams. But at the end of the day, after they were using it and they were taught, and we also did trainings, we had our IoT group, we had Microsoft come in and do webinars for the organization. We started to see collaboration happening on a level that we've never experienced when we were all in the same room. So the training went so smooth that we were able to push out training to 4,500 individuals using Microsoft Teams, using our collaboration and communication aspect portal, which is Atlassian Confluence, and being able to put all the information that we need for them to understand there. We leverage Atlassian and Confluence for what we call our traceability matrix, where we're able to put everyone in the same group, overlap their work with whoever needs to have some relationship. So if a policy changes and it changes an IT system, or it changes a training, it changes a report, and it changes legislation, that one click goes in and everybody in the stream understands it. We all have that level of visibility and transparency, and that traceability hits all the invested parties. Next slide, please.
Slide title reads, CWIS and Child Support Implementation Rollout. Line diagram that displays simulation systems. The CWIS system includes VRAAS, virtual reality, a CWIS platform, Salesforce, and Force.com.
One of the things we had to focus on with the CWIS system as we rolled it out is really implementing a system that is going to allow us to really focus on engagement and bringing our training into a driver's seat, not just sitting back and understanding, but a driver's seat. As you can see this display, the VRAAS is our virtual reality. We've integrated the virtual reality training and the responses and the engagements as individuals do a virtual reality session. We collect that data and it goes directly into our CWIS system. What that allows us to do is to identify the candidates as they come in, and we also put our seasoned veterans through that. We put our individuals who are new trainees through it, similar to how we do with airline pilots, where we put them through 100 hours, 1,000 hours, 10,000 hours of flight simulation before they can fly a plane. Well, we feel like we have the same risk model, prevention of loss of life. So putting our new hires and our seasoned veterans through hours and hours of these simulations and critiques and helping them understand some of the implicit biases you've identified or you now shown, and being able to overlap that information with their caseloads and map some of those responses to individual cases that are similar can show them where their biases have extended a child's stay and keeping them from getting permanency sooner. It also allows us to see, as we get generational changes in our people, where has our training, our traditional training, fell off, and where do we need to continuously improve that training so we're more in space where we're in alignment with today's worker and the scope of work that we're asked to execute. Part of that started with doing an organizational design, mapping our processes and understanding what our processes are, then building a system after that, after the business said what we needed, how we need to do it, and what they need us to do, and then bringing in our training and allowing our training to drive and be decomposed from our systems, from our processes and our people, and ultimately building that continuous improvement model that allows us to continuously improve all three at the same time. Next slide, please. One of the things I think is a major lesson for us, actually the three things that are major lessons for us and takeaways that I think one of the things I would like to share the most with anyone would be understand your organization and understand the hierarchy, people, process, and technology. When you put that in that order and you understand that people are the biggest effort that you have, they are the ones that you need to be able to make sure that you're giving them the appropriate information, you're converting that information for them into actions and business intelligence so that they can go and produce the outcomes that we need for our people. And the people start first. Then we manage the processes to support where the people have gaps. And then where those gaps exist between the process and the people, we build technology in that layer to bridge the gap between the two and have that harmony there. Keeping the main thing, that is super critical. So many times we can get caught up in the emotion of child welfare. We can get caught up in the emotion of a family and the family's needs. And we forget the main thing is to make that family whole. One of the things we try to focus on, keeping the main thing, and making sure that all of our efforts are focused on making sure that the experience and our engagement with the family is at its best, and it's the most efficient, and it's the most effective. And we're identifying the needs of the family early, so we get them the outcomes they need early, and we don't keep children in a situation where it's continuing to impact them negatively longer than we need to. The third thing, final for us, is really continuous improvement. Knowing that you're going to build these systems, and building the systems, starting with processes, starting with people that are flexible enough to be able to change, to be able to improve, knowing and owning that my job is to execute the continuity of their business, to get the child the outcome, and not owning some of the results from the perspective of, I have to get stuck or stay stuck in this space. Being flexible and focus on continuous improvement allows you the ability to look and see new ways to improve how we deliver training, how we deliver knowledge to our individual teams, and how we help them improve the outcomes they deliver for our children. Next slide. I think that's it for me. Any questions, if there are any?
Awesome, Kevin. Thank you so much. And I appreciate you. You ran through a lot of material really fast there. And covered a lot of ground with us. I'm sure that folks are very interested in hearing about how you're using virtual technology, or virtual reality, in your staff training, as well as your CWIS training, and also your quick pivot in terms of your COVID tracking, or your office tracking. And I think what stands out to me the most was just the speed at which you guys were able to develop that system. That's pretty impressive. So I'll go ahead and let folks submit their questions. You can submit questions directly to Kevin about Indiana, or generally to any of the panelists as we continue to move along here. And so I'm actually going to go ahead and just move us forward. But Kevin, if you could stay on, we are going to have another question and answer period right after we let Maine go ahead and jump in. So with that, I'm going to turn things over to David Iyer.
Yes. Good afternoon. Good morning, everyone. Hello, everyone. We want to thank the Children's Bureau for giving us the opportunity to share our experience. If you could go to the next slide. We had to pivot quickly during our implementation, training and implementation of CWIS. And I'm going to spend a few slides giving you a brief update about the history, background for Maryland, and then turn it over to a couple key members of the training and support team.
Other discussion overview points include original plan for training and implementation, COVID-19 challenge, shifting to virtual, lessons learned, critical success factors, and questions and answers.
Next slide, please. So I'm hoping as we go through this, it'll be evident that our program and business folks, and Jeffrey Lynn works with me on the program side. Rob Starkey is on the IT side, that you'll see that we work well together and quickly in order to make this shift to virtual training and implementation. I'd also just like to take a quick moment to give special thanks to Vanetta Martin and Krista Davis at our offices to help in the preparation for this presentation.
Contact information for David Ayer, Deputy Executive Director of Operations, is david.ayer@maryland.gov. Contact information for Jeffrey Lynn, CJAMS Program Manager's contact, jeffrey.lynne@maryland.gov. And contact information for Rob Starkey, Director and Strategy and Operations, is rob.starkey, STARKEY, @maryland.gov.
Next slide, please. So this is a little background for your information. Some quick facts about Maryland. Our organizational details. Department of Human Services has a few different administrations. We have our Family Investment and Child Support, as well as Social Services Administration, where I am with Jeffrey. we have both adult services and child welfare programs that we're responsible for. Rob, on the other hand, on the IT side is where our development powerhouse is. That's Maryland Total Human Services Integrated Network, or just more simply MD Think. And we work with him and his group. You can see some population figures and how many children we have under 18, some numbers about the services that we provide in the child welfare side. We have not quite 4,600 children in foster care, and about double that number of children being served in CPS and in in-home services.
Total population for Maryland's 24 jurisdictions, including Baltimore City, is 6 million, with 1.4 million, 23%, being under the age of 18. Other numbers include 4,450 families in services, 4,560 in foster care through the age of 21, and 1,135 reunifications, adoptions, guardianships, with the annual count being 77% of all exits.
Next slide, please. Little brief background on our systems development. So it was quite some time ago, February of 2006 to January of 2007. That's the time frame that we took to launch our CCWIS system. Our payments actually didn't go live until January of 2009. And we've been using MD Chessie for many, many years until very recently. MD Think got moving in stride after the new administration with Governor Larry Hogan stepped on board, and our project kicked off in January 2019. We have a lot of folks that are now using the new system. Our CWIS is now launched amongst 2,500 child welfare staff. It's part of a system known as CJAMS, Child Juvenile Adult Management System. And we have a lot of folks that are going to be using that in juvenile services and eventually in adult services, but we have completed the transition for child welfare. Next slide, please.
Slide title reads, Original Plan for Training and Implementation.
So just briefly, again, in terms of what happened pre-COVID, we had our usual kind of training and implementation ready to go. And we got underway in the fall of 2019 with an initial rollout, starting as a pilot in Washington County. And in January of 2020, we extended that pilot rollout in Anne Arundel County and successfully completed those tasks and getting those jurisdictions launched.
Other information for pre-COVID-19 includes testing, pre-go live unit training with all offices and iPads and phones distributed to all child welfare staff.
And we were ready to take the next big step. And if you go to the next slide, please, the next big step.
Timeline of rollout activities with sections including communications, training, and office prep leading up to the go live date.
In following our routine that we had put together, this was the pre-COVID lead up, as it were, the usual kinds of training. We have office prep and office visits, classroom training prep, the labs that we had set up for folks to practice, and then of course the materials and the communications, both few months leading up to go live, as well as the on-site and support that we would have an ongoing communication after we go live. And so that was our plan. So next slide, please. We got involved with 10 counties, 10 jurisdictions, about 850 staff. We were going to launch on March 23rd, but then COVID forced a big change in our working lives and in many ways, and it impacted our implementation as well. So next slide, please. We had to shift gears. We had same kind of agendas, examples, activities, but there was a need to work on getting more materials together and logistically shifting gears. We decided instead of virtually completing the training and launching in 10 jurisdictions, we split it up. We had 4 Western Maryland jurisdictions, counties in April, and then in May we had 6 Maryland jurisdictions that we launched in this fashion. So next slide, please.
2 calendars on screen sharing key dates for Phase 2A and Phase 2B trainings.
The details around shifting gears, the additional materials, changes in terms of which staff would handle which aspects of both the training and the launch, all shifted. I'm not going to go into great detail here, but there was an awful lot of work that the team, collective team, both on the business program side as well as the IT side, came together in order to make this work. Next slide, please.
Map of Maryland is shown with specific counties, highlighted for training and implementation. Counties include Garrett, Allegheny, Frederick, Carroll, Howard, Montgomery, and 16 others.
And so we ended up with a Phase 2A, as it were, and a Phase 2B with the 4 jurisdictions in Western Maryland starting out, followed by the 6. And then we have followed through with this virtual training and implementation in Baltimore City in June, and just wrapped up the rest of the state at the end of July. And so that's brief background as to where we've been. It's been a whirlwind, and I wanted now to hand over to the folks who will discuss details around how we made it all happen and just about stayed on track as well, which was a phenomenal achievement. So I'm going to hand it over to Rob Starkey, Director of Strategy and Operations at MD Think.
Thanks, David. Good afternoon, everyone. As David mentioned, I'm one of the IT directors. I'm focused on org change management, comms, training, user support, really anything at the intersection of our technology teams with programs and our local users. So as David set up, we strategically had to figure out really quickly how to pivot to remote and how to support our staff in doing that. We knew we were going to be trailblazers. The overall MD Think program is an aggressive modernization with planned rollouts beyond child welfare for the additional components in CJAMS, Maryland's new eligibility system, child support system, etc. And so I'm going to talk a lot about training in future slides, but we had to figure out more than training. We had to figure out how to remotely roll out, to have a remote command center, kind of on the system side, as well as how to prepare our users who were by and large working from home at this time. As from a readiness perspective, before we could do anything in figuring out this plan, we had to make sure staff had access. And so David mentioned this, but as part of our modernization, mobile network-enabled devices were largely distributed for child welfare staff tied to the rollout of this new system, which is accessible and optimized for iPads, regular PCs and iPhones. And so most of our staff already had that equipment, and fairly quickly, especially on the child welfare side, DHS pivoted remotely very fast. We also created an Amazon workspace solution. We did that as the modernization team. So some staff could access via their personal machines, etc. Overall, though, staff were largely ready. When we made the decision to pause the rollout of these 10 jurisdictions, it was actually some of those local offices who wanted to move forward because staff had been exposed and prepared. And the longer we delayed that, the more retraining, repreparation, and loss of productivity those offices would have. Just a couple of other points here. One of our key success things was having huddles, is what we called them, where we, after going live in an office, we would have on-site support representatives for at least a couple of weeks, and all staff would meet, all of the users would meet up in groups, and we called them huddles to talk about things, troubleshoot together, positives, negatives, ask questions, etc. So we had to figure out how to do those remotely as part of this pivot. And that on-site support component that was really important to our users, having folks immediately available, especially in that first week or two. We switched to a call center model using the Verizon One Talk app, where contractors and state resources on an 833 phone line were routed calls. It worked phenomenally well and was more efficient with our use of on-site resources. Overall, our goal is really to provide the same level of support to users through this rollout virtually, with most of them at home. Next slide.
Two step-by-step diagrams appear on screen. The first is for e-learning video development, highlighting the different steps involved, starting with script writing, visual aids, video creation, incorporating audio and final edits, review and feedback. Second is e-learning documentation development, highlighting different steps such as initial drafting, review and revisions, program review, publish, user feedback.
On to the training content side. We did have some folks who had experience with Captivate. We had team members, both contractors and state employees, who had experience creating videos, and we had done some of that creation of videos and communications, but we really quickly doubled down on Captivate as our tool in creating these e-learnings and e-learning videos. So we quickly, within a week or two, did an emergency procurement for more licenses of Captivate and Snagit, and some quick trainings to bring folks up to speed. And that same week or two, we gathered our communications office, some of our local users, David's team, our DHS training department, to build out a template and a proof of concept of what an e-learning course would be. And so we took our agendas that we had used for in-person training and started producing e-learning courses, which are really video modules, anywhere from a couple of minutes to maybe 10, 15 minutes, focused on workflows in the system. These were the same agendas, essentially the same modules that we would cover in in-person courses. Each of those videos was subtitled and would walk through the system with screenshots explaining how to complete the process, and ended with knowledge check questions that had to be answered correctly to move on to the next video module. And then each of those e-learning courses had corresponding practice activities for folks to dive into the system. So we had about 20 different people involved, probably at least 12 of them on a really full-time basis in producing all of this content. And we built an assembly line with scripts and outlines, screenshots. We had folks who did proofreading, people who entered subtitles from the scripts. We had one person who did all of the voiceovers, so we had a consistent voice. And overall produced in this month 72 of these e-learning videos. It ends up being around 12 hours, I think, of total content. And then we also produced how-to guides. We had some user manuals, some longer, kind of clunkier manuals that we had produced as part of training and course guides. But we wanted something that was tactical, both from a training and reference perspective. And so we came up with these how-to guides, which very focused on a business process in the system. For example, how to close a CPS investigation is one of our guides. And so at the same time in producing the videos, we also created over 120 of these how-to guides, which continue to actually get created and updated. Next slide. So we structured these e-learnings, these module videos, into 7 different courses by program area, and staff complete one or more of the courses depending on the work that they do. As we know, different offices structure staff in different ways. So we made this a very flexible curriculum, similar to what we were doing with our in-person classes, where everyone started with an overview course, which covered really the foundational elements. It's about an hour long, and that may be a very casual user. That may be their only training. but most of our child welfare staff would take one or more program areas, for example, screening, child protective services, etc. We also had courses for finance and supervisory. And so most folks on average took 2 to 3 of these courses and would watch the videos, do the knowledge checks, do practice, and reference the guides. And what was really important was the scale. We knew this had to work. These videos had to be clicked through. Our practice activities had to be incredibly clear because we were looking at training for these final rollout phases, almost 1,000 people per month to get through the rollout schedule. And next slide. So this is a couple screenshots of how things look like, but at what we finally rolled out, the package that we produced, we created a comprehensive e-learning guide, kind of a 1 or 2 page document to walk staff through how this would work. We updated a lot of our communications for those offices. David showed earlier our communications plan. We had to update that to reflect this new model. Staff were registered automatically, and Jeffrey's going to talk a lot more about the learning management system. By local management, they identified the courses, and then staff were registered in weekly groups is how we phase people through, just like you would in a classroom. You naturally would break up training. We wanted to do the same thing to spread the support. So we did weekly kickoffs with each group, live virtual kickoffs, where we would walk through with trainees the entire process, how to get into the LMS, how to, and give a demo of logging into the system for practice. This 833 phone line is what we use for all support. We got a lot of calls, particularly when people were in the system. So we could offer the same one-on-one support that we could in a classroom or a lab. And then we provided reports to our local offices who really monitored completion and compliance of their staff. And Jeffrey will talk more about some of the supplemental training opportunities. Next slide.
So good afternoon, everyone. Rob?
Yep, go ahead, Jeffrey. We hear you.
Okay. So good afternoon, everyone. My name is Jeffrey Lynn. As David said earlier, I'm the CJAMS program manager on the social services administration side. So I had the great pleasure, of course, I have worked with David for quite some time and with Rob in this process. So Rob talked a lot about building the foundation, and we have the Department of Human Services has a learning management system called the Hub. And the Hub is really our central repository for where we house all of the training that we do. And also it is a base for trainings that have been done previously for people to go back in as a reference. And I think for many of you know, being in the world of child welfare, we also offer continuing education credits to our social workers for their licensure. So this is the way that we track all of that. And we have been using this process, this learning management system for some time. But again, this was such a shift. And it really was one of the successes that I'll speak about in a little bit, because the world that we had lived in prior to this was always a face-to-face training. And we still were utilizing the Hub, but what was a bit different here, as Rob has alluded to, was this was very much like a college curricula. We worked with our Human Resource Development Training Division at the Department of Human Services, and with them, as Rob said, we would go to these locals and we would say, if Mary Jane was what we call a placement and permanency worker, an out-of-home worker, she would need to do the overview. And the overview consisted of very sort of specific areas that everyone might have to go into. What did a dashboard look like? What was the person profile like? How did they do a search? And how did they navigate? And this system is greatly different than the child welfare system we had that was MD Chessie, in that it's pretty much a flow. It's like one long area that they go through. They don't have to go through multiple folders and have all the duplication that they did with MD Chessie. So we had these curricula posted to a tile on the hub called My Transcript. And the expectation was when a worker went in, as Rob said, they would do the overview. We had the knowledge check questions. Then they would move on to, if it was placement and permanency, they would go through that. And each curricula consisted of different modules. But what was very important to us at the end of this were two things. We always, of course, wanted to do an evaluation that was attached to the hub. And in that evaluation, we asked two very critical questions. Did they feel that they had any policy program questions? Because one of the new assessments that the state of Maryland adopted is the Maryland Family Initial Risk Assessment. So if they had had a module where that was part of it in CPS, as an example, and they had program policy questions, we wanted to make sure, because that was new to them, that it filtered back to SSA so that we could get those questions answered. And I've always been a very big proponent of face-to-face training, which of course we had to move away from. So how do you do that? So we decided we were going to create, as an adjunct to this curricula, a hands-on type of training. So if someone went through the placement and permanency at the end, and they felt our case plans are quite new and service plans are quite new to the system and in general, they could then sign up through the hub again for one of these weekly sessions that Rob was talking about. And they were basically day-long sessions. And we had the expectation that in part of the work that they were doing through the hub and their curricula, that they had been into these practice exercises. They were very structured. The collaboration was wonderful between MD-Think and SSA, so that we built these out. And they would go through these practice exercises, but we would also have them use that training region URL and log on as we were doing these day-long sessions. So they comprised of both demonstration and hands-on. And it really did work very well. There was a little bit of making sure at the beginning everyone still had that log on to get into the training region. But we ended up, as it says here to date, we did a total of 1,118 child welfare staff were assigned e-learning curriculum. Some of them have not, as of yet, completely done them in total, but we're getting there, and it was a new process for many people, but 1,057 have completed the e-learning courses. And this is just a little snapshot there of how they register. So they would go on to a calendar, they would select the training if they were selecting one of these day-long trainings, and they would sign up for it. The curriculum was added automatically to their My Transcript, so they would just launch that. So next slide, please.
Assembly line graphic showing CJAMS support model that showcases its system support and program support.
So we really wanted to work on a support model and what was that going to look like. And Rob talked about this assembly line, which is a phrase that I love because it does take a village. Nobody can do this on their own. And the speed and I think the alacrity with which we did it truly was amazing, because I will give a personal example. We were in Montgomery County, and there were the whisperings of COVID. People had the hand sanitizer. Were they still to be coming? So it was very quickly decided in the midst of this training that we had 1 week to really complete it. So it's just sort of astonishing to me that we went and we took what we had and we were able to do it remotely. Now, for that particular phase, which was phase 2 of the rollout, we didn't structure this e-learning curricula yet until phase 3. But I think the point is we had a model. Came up with it very quickly. We built it very well, and we were able to move really without any kind of hesitation. And I think we also gave people, which is very important, the locals, a lot more say in this system. So we had something called the ticketing system of contact support. So at the beginning, a worker could enter a contact support system. Hey, this was in the legacy system, which was MD Chessie, but is now not in CJAMS. Or there was a defect or gap. I don't think any state who has ever launched a child welfare system launches one that is complete. CJAMS is very much of an iterative system. But in this process, we were allowing locals to have more collaboration about their system because it does belong to them. And as Rob pointed out, we did have command centers, which was very important because typically in the past, and I will give an example of Anne Arundel County, which was the second jurisdiction where we went live, we were all there. We were there for a couple of weeks, working, moving around to the different program areas, but of course we couldn't do that. So we had to change that and have this command center. It was very important that we had this communication of release notes when things were changing. Rob mentioned the 833 number, and I will speak more about the huddles. We also initiated a bi-weekly CJAMS management touch point call with directors, assistant directors, and managers. And this was very effective too because it was a means of keeping everyone abreast of the changes and things that they might have noticed within the system, processes where they needed a bit more support. And Rob did speak about the guide and the tip sheets. And those are continually changing as the system does change. We're discovering things that we need to amend. And one thing that was done on the SSA side, which I think was also very effective, was a program policy guide that dealt with, as I spoke about earlier, the new Maryland Family Initial Risk Assessment. It's much more of an actuarial assessment, but as can be imagined, there were questions about the abuse and neglect index and how they were to be answered on a program policy side. So we sort of married and baked all this together so that we were ensuring that all facets of this process were involved and really continue to be involved. We did the WebExes, and we did those continually, and we're still going back. We also have a monthly, what we call service affiliates meeting with the assistant directors of each jurisdiction, of the 24 jurisdictions. And Rob and I participate in that, and we just want to ensure that there's a comfort level there, that there's a reliability in the system, and that we are continuing, albeit virtually, to provide the support that we need. Next slide, please. So this is just a screenshot, actually, of one of the huddles. So you can see some of the staff from some of the jurisdictions who logged in. And as Rob said, I think they were tremendously effective. Sometimes they were a little bit large. We had to manage them a bit because sometimes you'd have upwards of 60 people on there. But we utilized the chat. We gave them the opportunity to work through, and Rob had his team there so that sometimes they were turning more into a training. I managed the on-site support team, so they would be there as well, if there was a quirk with a service log or there was a question about how to do something. We made sure that we were providing that to them. And there's a help desk, email assistance, the hotline, an inbox, so that we did have involvement from all parties, because you can't really launch something like this without that. And I think, and David would probably echo this, we did this a bit better than we did the first time with MD Chessie because they didn't have as much local input or collaboration with a system like this that we are trying to get to now, and still managing to do it all virtually, which is very big. So the next slide, please. So I think there were many critical success factors. I mean, from my standpoint, to go from an audit really predominantly had been used to face-to-face training. That's not to say that, and Rob mentioned Captivate, which is an e-learning tool that we use. Not to say that we didn't periodically do that, but we really were in a world of face-to-face training, particularly on a system like this. So to sort of make that leap and have the acceptance was there, and they were motivated to embrace this new kind of learning, because any of us who have been, in the last decade or so of college courses or any courses have a virtual type of curricula that we might have to go through. And we might have, a professor or a teacher or a guide that leads us through that. But for us, it was really quite new. And it was planned out very, very well. Between SSA and MD Think, we would have these sort of constant meetings. How are we going to do this? And I will just add one thing that I think is very important to note, and this is going very well too. Our Office of Adult Services has never had a database. They have been in a paper world for many, many years, and they, of course, are the A in CJAMS. So they have begun doing testing, and they've been doing user acceptance testing virtually. We are in the fall going to move to their training, which will be a bit of a different curricula because they will have never been in a child welfare system before. But there's all that planning, there's all that preparation, and we're making sure that staff are pre-equipped. Do they have VPN access, which they need in our case to work remotely from home, and do they have the devices that they need? The state also, right before we went to COVID, was introducing state phones for them to take out and be able to access CJAMS from those devices as they are meeting with the families. Because many times in the past, workers were beholden to come back to a brick and mortar location. Now, they're not meeting with families as much right now, but they're still using their iPads and they're still using their phones to do their work, which was also a transition. And yes, this collective effort across MD Think and child welfare and the ongoing program and IT work and the relationship, it was a lot of diligence in providing that continued follow-up through those hands-on trainings. And I will say we've gotten a lot of very positive feedback from that. We had to ensure that the ones that we posted to the hub were also 508 compliant, but you don't have that human interaction there. And we are now using cameras. So when we do a training, either Rob's team or my team, we'll have a camera there, which also sort of bridges that gap. You can physically see someone and know, hey, this person is leading me through this process. And it makes it much more sort of personal and a bit more intimate. And we use these e-learning platforms and the hub, which we continue to use, and just definitely made sure that the locals were engaged and still are engaged through this process. So next slide, please. And in any process like this, there are lessons learned. It was difficult for some of the locals to obtain the equipment that they needed to move to remote. People are working from their homes. We had to take that into consideration, the VPN access, and this form of communication. We were notorious at SSA and MD Think for having these in-person meetings. Well, all of that, of course, had to change to virtual. And as the system changed, because it is so iterative, making sure that we were keeping everyone apprised of these policy or practice changes and changes within the system. And yes, there have been some, issues where we had all of a sudden 400 people on the system. So, that's going to cause a little bit of slowness, but we've overcome all of this very well. And the ticketing process, in a conversation I had with Rob, we sort of opened up this door so wide to everyone that we got all of these tickets. And we had to sort of winnow it down and say, now we're just going to have supervisors approve these tickets so we don't have duplications and we can focus more on new tickets that are being submitted and the continual application support. And we had to have flexibility in the plan. I think that's one of the key factors in this was the flexibility, because it happened so quickly. You know, it was just like the curtain came down, no more face-to-face, and what is the plan going to be to move virtually? And setting realistic expectations of both participants and of the system. It is a system that's still being built. It was a very new way of doing training. We have never developed a curricula like this that someone would go through in completion with a number of different modules. So some people had problems with that. We had to go back. We had to adjust the length of the videos. And we had to just remember that we had to continually, and still do continually, update their resources and just make sure that we had that ongoing user feedback. But I will just say personally, in all the years that I've done this, I think it was one of the happiest, most exciting things I've been through, because we met the challenges, and we've been able to do it very successfully. So I think, Phil, you wanted me to turn it back over to you for the Q&A, correct?
Philip Breedenbucher speaks.
That's right. Thank you so much for all that information. And as all of you were talking, we started receiving lots of questions. So we'll do our best to get to as many as we can. The first one is very general, but it could be helpful for everyone. And the question is, will this presentation be available and the slides be available after the webinar? And the answer is yes, it will. We will post this webinar once it's gone through 508 process to our website, and we can notify you when that's been done. If you would like a copy of the PowerPoint, if you could email us, that would be great, and we can facilitate that for you. Okay, the next question, and I think I'll throw this first to Marilyn, but then I would like also Kevin, if you wouldn't mind following up and providing a response as well. The first question that came in, and also I just want to mention, if you have questions, you may use the chat box, you may use the Q&A function or the raise hand function. And so any of those will work. I just saw another question come in. Thank you very much. All right, so let's get through these. So the question is, what was the total project time or length anticipated to be prior to COVID? And then what did it end up as post-COVID?
This is Rob from Maryland. On the child welfare side, we ended up catching up in the rollouts. So we had planned to complete in July, and we did our final rollout in July. So we, while we paused, we lost a few weeks, we ended up catching up towards the end, and we're doing monthly rollouts. So it ended up not impacting our timeline.
Awesome. Kevin, did you also want to respond to that?
Absolutely. So I had 2 projects in flight at the time, with one in process as far as RFP. So I would say all of my RFP processes continued as expected. There were no issues there. We switched to Teams and used virtual to manage those and adjudicate those out. We had our DDI for child support in flight. We originally had a 2.5-year DDI for that. We had an initial deliverable that was supposed to be delivered in the first 90 days. So the first deliverable we finished at in 2 weeks early. We were able to complete our requirements gathering and confirmation. And then we're 20 days early on the first actual deliverable out to production. So we're going to pilot now for the first deliverable. So we're a few weeks earlier than we had planned on that. We were also in OCM on the child welfare side. So our organizational, we call it organizational design, but organizational change management, we were in the middle of that process. We had already started probably about a month or 2 in, and then COVID hit. We paused for 2 weeks only because the vendor, their method and their methodology, they felt that they couldn't process anything without being in the room with everybody. And I'm like, look, man, you know, we have Teams, turn it on. We're going to turn on Teams. You're going to do this, or you won't be getting paid for the next 5 to 6 months because we're not coming back to the office anytime soon. So they went ahead and did it. And we were able to complete, with the exception for the 2 weeks where we paused, we were able to complete on time. And actually, we were able to get more done and faster. And they actually have modified their methodology now to support doing it remote with teams and tools like that. So it was all positive for us.
Thank you both for that response. I'm just going to go actually back to the first question, if that's okay with everyone, because a couple follow-up questions came in. So if you would like a copy of the PowerPoint, you can email ccwis.questions@acf.hhs.gov. And we'll post that also in the chat. So it's cwis.questions@acf.hhs.gov. Okay, we'll post that as well. The next question here, and it's okay with whoever wants to jump in on this one, but the question is, what resources were used for implementation and training, planning, development, and execution? And all state staff, vendors, a combination. So the question says, we are a small state team of 6, but we eventually procure a vendor to help with implementation, OCM, and system training. So this is a smaller state with a team of 6, asking what resources were used for the implementation, training, planning, all of that. Was it state?
So this is Kevin, Indiana. I did a total of about 7 RFPs, each one covering the OCM vendor, the project management vendor, the IVNV vendor, and on our child support system, we had a QA vendor. We do not have it on child welfare. We combine project management and QA together. And then our design, development, and implementation system integrator. We did that, even though our teams are capable of doing that, we did that to have a business partner in all those areas and make sure that we get it executed. We wrote those RFPs, we procured those vendors, and they've been involved in managing that. So in our OCM, there was a training aspect. Our OCM was responsible for building all the changes and processes that we will experience with the new system based on their recommendations and based on what gets built into the system. That OCM vendor wrote all the user stories that then fed the actual design and development of our CWIS system. So those process changes that are outside or aren't going to have workflow or automation built around them, those changes came from the org design vendor. Then the actual DDI vendor consumed those changes. And there's a training vendor who's building curriculum out with my team. I do have an on-staff team for training. That all of the changes, all of the documentation, the manuals, the configuration are flowing down to our change vendor. The good thing about our system, we're using a system that is a configuration-based system, and it's Salesforce. So we have training available from the platform provider free. So I've been able already have 5,000 users that are field case managers, family case managers, and field users in general, and they already have been training themselves, and they've been using our platform. So the baseline of the system, they have that. Also to the point where I have clerks and family case managers who are certified administrators on this. So they have gone even further to be certified engineers on our platform. And that's how easy it was, or at least how excited they were about the new system. So we try to take advantage of an entire ecosystem, platform providers, our DDI vendors, our other partners who are working with us to build that. And we've shared with other states our RFPs and documentation. So you're more than welcome, if you're a small state, if you want to use some of the work we've already done, so you don't have to reinvent the wheel for a CWIS system and for a child support system, we're more than willing to share with you.
Hi, everyone in Maryland, in relation to resources, wanted to just start off and then hand over to Rob. On the state office side at Social Services Administration, we have a unit, an Office of Systems Development, which contains the unit that Jeffrey leads in relation to training and support, as well as a unit that helps with the infrastructure and the development issues that we need to focus on, and also a payment hotline called group that helps with any payment related issues. In relation to the training, planning, and implementation, it largely fell on Jeffrey and his team of 3 trainers, professional trainers that have been with the organization for many years. In fact, they've been ongoing with training and support to the CHESI, the legacy CCWIS system for many years. And he and his team joined with the IT folks that were brought in as part of the ramp up to training and implementation on Rob's side in MD Think. And I'd like Rob to take a few moments to talk about the resources that we had there, because we had to depend on a lot of folks through MD Think to help pull all of this off.
Yeah, David, the one thing to know, our vendor environment is a little different than traditionally. We didn't procure like an OCM or a training vendor. What we do, same thing for all of our DDI resources. The state kind of directly is managing all things from a director or manager perspective on the modernization side directly, and then we use vendor resources and individually do interviews. So it's essentially a by-person, multi-vendor environment where all of the folks are essentially individual contributors. We work together as one team, with Jeffrey's leadership and his 3 resources, and supplemented with maybe 15 or so at absolute peak. In addition to our contractors through the modernization project, we also had some of our legacy technology support staff, so folks who would call in and regularly support production users and help them with tickets, for example. We had 3 or 4 of those folks plugged in directly with the support and assisting with trainings as well. And the last thing I'll say, with our local users, some offices have more support staff, obviously our larger metros, for example, and may have some folks that really played critical roles in implementing and training in those offices, for example, in coordination or even doing some super user supplemental type of training. So it was an all hands on deck, but we worked as one integrated team and actually did do a morning scrum call together every morning at 8:15 with all of our contractors, Jeffrey's state resources, legacy technology folks, myself, and others.
This is David. One more point I wanted to add. In addition to the folks on our operations side, we also have a few folks on the program business side at SSA that have been very importantly involved with design, development, testing, as well as assisting with preparation for the training and providing some of that policy practice-oriented feedback that's needed along the way. They were very much involved as well. Key folks from both the CPS side, intake, CPS, and in-home side, as well as from the out-of-home side. And our 4E director of eligibility and compliance was very active as well in supporting all of those efforts.
Right, and this is Jeffrey, and I would just add to what both David and Rob said quickly. Yeah, it was very much collaboration. There were policy program people from the locals. We did the testing of so much of which was done remotely, particularly for an area like adult services. So it was sort of work, come back together, work, and then use these resources that were there and expand the resources so that we got to the point where we are.
Great. Thank you both. Or thank all of you. All of our panelists, I think, chimed in on that one. I just wanted to, it sounds like, Kevin, there are some folks that would like to take you up on your offer of you sharing some of your information and documents. And so I think the easiest way to facilitate that is, Kevin, if you'd like to type your email address in the chat function to all attendees, you're welcome to. Otherwise, we can field those for you. I've put in the chat function for all of you the CWIS email address. Again, it's cwis.questions@acf.hhs.gov. If you email us there, we can get you in contact with Kevin. which may be the easiest way to facilitate that. So thank you very much. There's one last question. I'm going to ask our presenters to be somewhat brief as we're getting close on time, but I think it's an important one. The question, that's a very important question, actually. The question is, how do you help individual counties, or do you help individual counties with changing their business processes? And how county specific did your implementation program go into this? Maybe we'll start with Marilyn this time.
Hi, everyone. This is David. That's a great question. And I think that is a work in progress. There are aspects of the new system that bring with it, as Jeffrey had mentioned earlier, there were some new assessments that were going to be coming into play. In fact, we had gone through a little period of time for several years where we wanted to add some things into the legacy system, but we were asked to wait until we got to the new system. So there were actually a few things that fell into place, and a lot of effort that's needing to be made. So we have worked through individual questions from jurisdictions. We've held overviews with folks as well. I think one of the challenges is just shifting gears a little bit on looking at the whole family in relation to service planning and overall one family, one plan kind of orientation. And that's going to continue to be a little bit of a work in progress with our folks. And so we're continuing to manage that through the ongoing communications that we have with the local jurisdictions, and any additional training and updates that we will do. Eventually, the new routines and the new shifts in practice will plow into place as part of the transition that we've now made with the system.
This is Kevin from Indiana. So yeah, we did. I'm a classically trained systems engineer. So I used a systems engineering methodology for identifying scope and identifying the actual needs-based analysis for 92 counties. And the interesting part of that is the 92 counties are also two entities we have to deal with. This is primarily on the child support side, which was the county clerks and county prosecutors. And all of them, their domain is their domain. So it was interesting. And one of the things we did, and we didn't have to do it on the welfare side as much because we own the end-to-end process. But one of the things we actually really did in the early discovery was that everyone was calling their own personal workflow what they were as their own process. So the issue was, once I was able to convince all these educated attorneys and accountants that the continuity of business for the process is the same. It doesn't matter who, what, when, where, why, it's the same. So we identified that 80% that was the same. And we were able to say, okay, we got this, 80% is there. Let's look at the 20%. Let's identify what in that 20% is the challenge. And what we were able to discover was it wasn't really workflow. It was more so how they manage their work. So we were able to identify that individuals actually assign work or allocate work, and potentially they have more silo-based versus collaboration-based because they can afford to have more people who are specialized. And once we were able to get down to the main thing, keeping that main thing the main thing, we identified probably about 5 real major types. And we were able to manage that by setting up our user access matrix. So basically setting up users and giving them access to certain functions and features based on those 5 major types. And then the other areas, they were able to customize their own user interfaces, which is why we chose the platform we chose, was because it has the ability to make your user experience be whatever you want as an individual. And once we were able to demo that, the conversation around, this is my own workflow, I need my own OCM, it went away. And we were able to really identify the different business measurements we need to put in place to be able to support customizing their user experience so that they feel as if they're getting exactly what they want. And so far, everyone's been excited and happy about that. So we did make the effort to try to understand the need, and then we identified what the need was, and we were able to solve that problem.
Well, that is amazing, and I appreciate all of our panelists today from Indiana and from Maryland. And panelist, Nicole Carter-Schaefer. Thank you so much. Let me just kind of wrap us up here with some final thoughts and things that we've heard today. And we just want to encourage you all to be creative and flexible. Do what you need to do and do not be confined by history. We heard a lot about the ability.
I'm sorry, Phil. I'm sorry to interrupt you. This is Nicole. We cannot hear you.
Thank you for interrupting me. How was that?
That's better. Thank you, sir.
Yes, glad you're here. All right, let me just start again. I apologize for that. So we just want to wrap up today and encourage you to be creative and flexible. Do what you need to do and do not be confined by history. We heard today a lot of folks on how they were able to move with such speed and such grace. And we don't always hear that with large agencies that you all are working in, and that's wonderful. We again want to encourage you to engage and assess at all levels, assess for learning knowledge, and of course also assess for the quality of training and be able to pivot and adjust as needed. Stay connected. Users really need to have access to their trainers or super users. We heard the idea of these huddles, and they were able to pivot and provide immediate feedback to continually assess and so that they can feel supported and engaged in the process. And we heard much of that today. And then I'll leave you with this. What are your next steps? What are you learning from this process and how you've had to pivot in your own states? And what changes might you be making that will change the way in which you will always provide CWIS training and rollout? We'd love to hear about that. You can email us that. You can reach out to your analyst. We'd love to hear those lessons. And again, we thank you today for joining us. We do have an upcoming webinar that is scheduled in September, and that information will be forthcoming to all of you very soon. So again, with that, we thank you all for being here. Again, I want to thank our panelists, our staff behind the scenes, Nicole Fuller, and also Rush Bishop. Thank you very much for your support on this. And we hope you all have a great day and stay safe and healthy. And that will conclude today's webinar.